January is Cervical Health Awareness Month. Last year, it's estimated more than 14,000 new cases of cervical cancer were diagnosed in the U.S. alone. That's according to the American Cancer Society. However, cervical cancer is very preventable, and detecting it at an early stage gives it the highest likelihood of success in treatment. Thanks for joining us for this week's Health News You Can Use. I'm LINDSEY STICH. This week, we're talking to Dr. Jason Knight, Director of the Gynecologic Oncology Program and surgeon at St. Luke's Health System, about the importance of HPV vaccines, cervical cancer screenings, and treatment options for various stages of the cancer. With me today is Dr. Jason Knight, surgeon and director of gynecologic oncology at St. Luke's Health System. Thanks for joining us.
It's my pleasure.
Well, Dr. Knight, what's the main cause of cervical cancer?
Most cases of cervical cancer are caused by human papillomavirus, or HPV. It's commonly transmitted by intimate or sexual activity, and men and women can be carriers of the disease.
So what steps should people take to reduce their risk of HPV and cervical cancer?
There are three cornerstones to risk reduction. The most important is probably HPV vaccination. Vaccination is approved for boys and girls starting at the age of 9, and vaccination can be completed in 2 or 3 doses depending on the circumstances. While the vaccine is approved up to the age of 45, it's most effective when it's administered prior to the onset of sexual activity. The second thing that a person can do is to get screening. Screening involves pap testing with or without an HPV test, and screening allows us to detect disease before symptoms happen when the disease is most treatable. The third thing people can do is to practice safer sex practices.
Okay, so what are the warning signs of cervical cancer?
Because cervical cancer doesn't frequently have symptoms at its earliest stages, the most important things that we can do are prevent the disease with vaccination and detect the disease in early stages with screening. When there are symptoms, the most common symptom is abnormal bleeding. Abnormal bleeding can be defined as bleeding in between periods or bleeding after sexual intercourse. Keep in mind that abnormal bleeding can be caused by a variety of problems, and it's important to seek medical help so that the appropriate tests can be performed to identify the cause of the symptoms.
Okay. So why is the HPV vaccine so important?
The HPV vaccine is the cornerstone of prevention simply because it's so incredibly effective. When the vaccine is administered before exposure to HPV, it is 97% effective in preventing cervical cancer. And that's why early vaccination is important.
Now, when someone has their screening and is diagnosed with cervical cancer, what are the treatment options?
There are many treatment options, and the one that's best for a person depends on how advanced the problem is, as well as whether the person is eligible and interested in fertility-preserving options. For a younger individual with early stage disease, a less invasive treatment option may exist that also preserves fertility. For individuals who are a little bit older, or who have slightly more advanced disease, a more invasive option may be the best approach. And for individuals with widely advanced disease, surgery may no longer be the best option. And in those instances, a combination of chemotherapy and radiation may be the best option.
Okay. Now, what age group is most likely to be diagnosed with cervical cancer?
In our practice, most individuals are diagnosed in their late 40s and early 50s. Nationally, cervical cancer typically presents between the ages of 40 and 55. Keep in mind that up to 20% of cases can occur in individuals aged greater than 65.
So what sets St. Luke's apart when it comes to treatment for cervical cancer?
St. Luke's has a state-of-the-art gynecologic oncology program that provides expert diagnosis and individualized treatment options. What sets the St. Luke's Gynecologic Oncology program apart is our innovation. Among other things, providing services such as scarless laparoscopy, state-of-the-art chemotherapy options, and a wide variety of radiation treatments for people with cancer.
Well, is there anything else you'd like to add for people watching today?
Over the pandemic, we have noticed that people have been deferring some of their health screening and health maintenance items. And that has resulted in people coming for care when their cancers are more advanced. So I'd like to take this opportunity to remind people to make their health screenings and health maintenance a top priority.
Great reminder. Well, thank you so much, Dr. Knight, for joining us.
Thank you.
To make an appointment for cervical cancer screening with St. Luke's gynecologist or to get the HPV vaccine, visit stlukeskc.org/gynecology and learn more about our gynecologic oncology program. Visit stlukeskc.org/GYNONC. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.